Welcome to the Chemotherapy Education Program. You are viewing this presentation because your doctor recommends that you start a chemotherapy regimen known as Folfiri, with or without Bevacizumab. We will now review side effects you may have and how to manage some of them on your own. Before we talk about specific side effects, please note that different people have different reactions or side effects to chemotherapy. Unfortunately, we will not be able to cover every chemotherapy side effect. Instead, we will review the most common side effects. Serious but rare side effects will also be discussed to help you identify when to seek urgent medical care. While your chemotherapy can potentially cause nausea and/or vomiting, we commonly give IV medicines at the start of your infusion appointment to prevent nausea. Some of these medicines are listed here. Ondansetron and dexamethasone are standard anti-nausea medicines for your type of chemotherapy. In case you develop nausea away from the hospital, your oncologist will prescribe medicines like ondansetron or prochlorperazine that you can take by mouth. Each medicine works differently, and your prescription bottle will indicate how often you can take each medicine. Only take these nausea medicines if you have nausea. Your white blood cells, which help the body fight off infection, will fall after you receive chemotherapy. You can reduce the risk of infection by practicing healthy hygiene habits, such as washing your hands regularly and avoiding contact with sick persons. Keep an oral thermometer with you. If you develop a fever greater than 101 degrees Fahrenheit, 38.3 degrees Celsius, this may be a sign of infection. Immediately go to the nearest hospital emergency center. You may have anemia if your red blood cell count is low. Typically, this can result in fatigue, dizziness, or shortness of breath. We encourage patients to stay active and do light exercise in between chemotherapy treatments, but take care not to overdo it. Patients with low platelet counts may bruise more easily or take more time to recover from scrapes and cuts. Before each dose of chemotherapy, you will complete lab work to check your blood counts. Irinotecan may cause diarrhea and abdominal cramping. This diarrhea typically begins 3 to 5 days after receiving irinotecan, but is different for each patient. It is important to control diarrhea as soon as possible to avoid dehydration. The longer diarrhea continues, the more difficult it is to stop. If you have an ileostomy or colostomy, you may notice changes in the consistency or color of the ostomy output. You may also notice that you need to change your ostomy bag more often. Any of these can indicate signs of diarrhea. If you develop diarrhea or abdominal cramping while getting irinotecan, your nurse may give you an IV medicine called atropine to stop your symptoms. Atropine can also treat other symptoms like excessive saliva, sweating, tearing of the eyes, and runny nose. In case you develop diarrhea away from the hospital, your oncologist will prescribe medicines like loperamide or diphenoxylate atropine that you can take by mouth. Your prescription bottle will indicate how often you can take each medicine. Only take these medicines if you have diarrhea without a fever greater than 101.3 degrees Fahrenheit. A high fever can indicate an infection that should be checked by a doctor. In addition to anti-diarrhea medicines, it is recommended to drink 8 to 12 8-ounce glasses of clear fluids daily. Following the BRAT diet can also help to minimize diarrhea. The BRAT diet consists of bananas, rice, applesauce, and plain toast. Irinotecan may cause hair loss in some patients. It may take up to 3 to 4 weeks before you start noticing hair loss. Hair typically begins to regrow after treatment ends. MD Anderson offers a beauty and barber shop that is open Monday through Friday. Fluorouracil is usually well tolerated, but some side effects include mouth sores and diarrhea. Preventing mouth sores is key. You can make a home mixture of baking soda and water. Swish and spit anywhere from 2 to 4 times daily. Using a soft bristled toothbrush and practicing good oral hygiene can also help reduce mouth sores. If you still develop mouth sores, tell your healthcare team. Diarrhea can also occur with fluorouracil. To treat this, follow the previous guidelines for managing diarrhea caused by irinotecan. Hand-foot syndrome is most commonly described as any redness, dryness, or swelling of the soles of the feet or the palms of the hands. You may also notice discoloration of your hands and feet. If peeling or blistering develops, it can be painful. To help prevent hand-foot syndrome, apply moisturizing lotion several times daily. At the next clinic visit, tell your healthcare team if you have problems with hand-foot syndrome. While receiving Fluorouracil, you may sunburn more easily, so apply sunscreen and wear protective clothing when outdoors. Although rare, patients taking Fluorouracil can develop changes in their heart function. This usually happens while the pump is infusing Fluorouracil. Go to the nearest hospital emergency center if you have pain or tightness in your chest. Your oncologist might add a third medicine to your chemotherapy regimen. Bevacizumab works by preventing new blood vessels from forming and stops the growth of the cancer. Common side effects include increased blood pressure, minor nose bleeding, and headaches. At each visit, your healthcare team will assess all side effects prior to receiving the next dose of bevacizumab. In patients who have undergone a recent surgery, bevacizumab slows down wound healing. It is important to tell your oncologist about upcoming surgical procedures within the next 30 to 60 days. Rare but serious side effects include a risk of perforation, obstruction, major bleeding, or blood clots. Immediately go to the nearest hospital emergency center if you develop serious symptoms. These include significant and new abdominal pain, severe nausea or vomiting, inability to have a bowel movement, a severe nosebleed that won't stop, blood when you cough, new chest tightness, and a swollen and red leg that is painful. Let's take a moment to talk about safety, your safety at MD Anderson. To ensure the safest approach to administering the right dose of chemotherapy to the right person at the right time, several steps are in place at MD Anderson to ensure high-quality health care. In fact, multiple providers review and sign off on your treatment to guarantee the highest level of accuracy. You and your caregivers also play a role. Always check that your identification wristband is correctly labeled with your name and medical record number. Every provider should confirm your identity and all medicines should be correctly labeled and identified for you. Before we finish, here are several helpful tips and resources. You may want to pack a bag to take with you to the infusion center. Some examples are listed here. The ATC offers free Wi-Fi and television. We recommend that you eat prior to your treatment, but you may also eat or drink while receiving chemotherapy. If you have an implanted port, remember to ask for EMLA numbing cream. To reduce pain, apply the cream 30 minutes before each time your port is accessed. For more information, visit the Learning Center. There, you can find additional information about cancer treatments and general health. We hope that this presentation has helped prepare you for chemotherapy. If you have questions, please ask a member of your healthcare team.